All right, everybody, Dr. Rayford from Vet Triage. We're going through this issue of JAVMA, July 1st, 2015, and it's a special report. They say here, description of a novel fatigue syndrome of finished feedlot cattle following transportation. The study comes out of Kansas State University Vet School, Texas Tech University, and the Iowa State University Vet School. The summary of it is that in the summer of 2013, there were a bunch of cows that had non-ambulatory or difficult movement and that sloughed the hoof walls. Tachypnea, abdominal component to breathing, lameness, reluctance to move. The serum lactate concentration and creatine kinase activity were increased. Histologic findings include diffuse necrosis of the epidermal laminae with degenerate collagen and perivascular infiltration of neutrophils in the underlying deep dermis, and were similar for digits that had not sloughed the hoof wall. This is similar to signs seen in pigs with fatigued pig syndrome. Anecdotal evidence generated concern that cattle fed the beta-adrenergic receptor agonist zilpaterol hydrochloride were at risk of developing mobility problems compared with cattle not fed this drug, but the condition is likely multifactorial. All right, so introduction. Many abattoirs stopped accepting zilpaterol-fed cattle, and the manufacturer of this drug voluntarily announced suspension of its sale in the U.S. and Canada August 16, 2013. Fatigued pig syndrome is a multifactorial condition in which affected pigs become non-ambulatory without any injury, trauma, disease, and they refuse to walk. It is associated with many factors, including stress, stressful handling, transportation, the feeding of this drug at doses near the upper end of the initially approved range. Beta-adrenergic receptor agonists fed to pigs and cattle during the last few weeks of the feeding period to improve feed efficiency and increase carcass leanness. And then you can see here a picture of a cow with the sloughed hoof, and then some pictures of the damage done. In the top picture, that's an adult Bose Taurus type beef crossbred steer showing sloughed hooves. And the bottom picture shows various indications of the same thing. So they had two case reports here. Case 1, August 5th, 2013, about 200 Bose Taurus type crossbred beef cattle, less than 30 months of age, arrived to a regional abattoir after being transported less than 400 kilometers or 249 miles from a commercial feedlot. 10% of them sloughed the hoof wall for one or more of the digits. 15 of them with sloughed hoof walls were euthanized, and they performed histology. Sloughed hoof walls accompanied by severe necrosis and hemorrhage of the underlying laminar dermis of the affected digits. Lungs showed atelectasis and homogeneous eosinophilic material known as edema, and extravasated erythrocytes, hemorrhage. Liver had some abnormalities to it. The heart showed protozoal organisms consistent with Sarcocystis species, which, by the way, in this paper, they don't mention if that protozoal infection matters or not. The mean liver selenium concentration of select serum biochemical variables, and the estimated concentration of zilpaterol in serum and retinal specimens were summarized, and they have it in a table here. Let me show. We're not going to go through the numbers there, but in case anybody's interested, those are the numbers for the table here. Case 2, September 11th, 2013, a Holstein steer, less than 30 months old. Similar sort of history. The mean liver selenium concentration, the concentration of select serum biochemical variables, estimated concentrations of zilpaterol and ractopamine in the retinal specimens were also summarized in that same table. All right, discussion. August 16, 2013, the drug sponsor announced suspending the sale of zilpaterol in the U.S. and Canada. It is possible that severe necrosis of the lamellar tissue of the cattle of this report obscured any histologic findings associated with carbohydrate overload. Therefore, they cannot rule out that the cattle did not have carbohydrate-induced laminitis. However, in their experience, the degree of laminar necrosis that resulted in sloughing of the hoof for the cattle here were more severe than seen with carbohydrate-induced laminitis. That you can also have sloughed hoof walls due to selenium and ergot alkaloid toxicoses and trauma, like if hooves get stuck in the equipment or fences and then being traumatically separated from the underlying dermis. But for cattle, in the cases in this report, selenium and ergot alkaloid toxicoses were considered unlikely because the hoofs, because the sloughed hoof walls, because liver selenium concentrations were within reference range, and laboratory analysis of feed from the feedlots yielded negative results for ergot alkaloids. Ergot is a fungal infection. Histology of the visceral organs of the cattle were considered incidental. Pigs with fatigued pig syndrome frequently develop open mouth breathing, reluctance to move, stiff gait, muscle tremors, blotchy skin, but don't slough the hoof walls. Compared with normal pigs prior to slaughter, pigs with fatigued pig syndrome have increased lactate and creatine kinase. The cattle here had elevated lactate and creatine kinase, in addition to reluctance to move, and some had muscle tremors. Results of another study that involved finishing pigs indicate that fatigued pig syndrome is associated with feeding the beta-adrenergic receptor agonist ractopamine, and pigs with fatigued pig syndrome have heart rates and catecholamine concentrations that are increased from basal concentrations, which results in behavior changes that make the pigs more difficult to handle and difficult to move at the time of shipment and less tolerant to stress. In that study, other observations, the manufacturer of ractopamine reduced the recommended dose and added a caution saying that this might cause a number of injured or fatigued pigs during marketing, meaning transport and lairage. However, pigs not fed ractopamine also developed fatigued pig syndrome, and factors affecting them include heavy body weight, aggressive handling, and the use of steep ramps for loading and unloading. When administered in accordance with the label, zilpaterol has a slaughter withdrawal of 3 days, meaning you can't slaughter them until it's been 3 days since the drug was given to them in order to be safely consumed by humans. If the withdrawal of zilpaterol is accompanied by changes to the ration or the time the cattle are fed, then the simple act of no longer feeding the cattle the ration that contains the drug might cause diet-associated metabolic changes and represent a stressor that could contribute to the development of fatigued cattle syndrome, irrelevant to whether or not the beta-adrenergic receptor agonist has a direct role in the pathogenesis of the disease. Fatigued cattle syndrome may also have a seasonal component. They see it in the summer and not other seasons. Temperature could be a risk factor. Body weight could be a risk factor. The mean carcass weights for finished steer in the U.S. have increased from a range of 350 to 361 kilograms during the summer of 2000 to a range of 391 to 396, so 30 kilograms more during the summer in 2012. Similar to fatigued pig syndrome, the time of day the cattle are loaded into trailers for shipment, the handling technique used to load them, the distance they have to walk to be loaded in the trailer could all be factors for developing a disease regardless of the drug. Results of the study conducted by a laboratory group who wrote this paper indicated that serum lactate and creatine kinase were not different amongst zilpaterol-fed steers, ractopamine-fed steers, and steers not fed beta-adrenergic receptor agonists that were maintained in a typical feedlot setting with minimal exposure to stressors. The increase in the mean creatine kinase for zilpaterol-fed cattle reported in the FDA Freedom of Information summary for zilpaterol was relatively minimal compared with the creatine kinase measures in this report. An increase in lactate indicates that fatigue and stress have depleted the muscle's glucose, with a subsequent buildup of lactic acid and metabolic acidosis, which can cause muscle stiffness and tremors. Pigs with fatigued pig syndrome that are allowed to rest can recover and be normal. Both fatigued cattle and pig syndrome have signs similar to other conditions, so maybe there's a genetic component. For example, in Australia, they described bovine stress syndrome, which is associated with exercise-induced hyperthermia in beef cattle. Cattle with bovine stress syndrome frequently have anxiety and hyperactive, stiffness, muscle tremors, recumbent, shallow breathing, tetanic stiffness, increased respiratory rate, increased lactate, increased creatine kinase, but they show signs at 1 month of age, and these signs persist through life regardless of season. In pigs, symptoms associated with porcine stress syndrome or malignant hyperthermia mimic those of bovine stress syndrome in cattle, and it's a simple autosomal recessive disorder. Cattle with hereditary muscular hypertrophy, meaning double muscling, respond to stress with symptoms similar to that of cattle with fatigued cattle syndrome: reluctance to move, increased lactate, increased creatine kinase following exposure to stress and exercise, clumsy with stiff action of the pelvic limbs, less flexion of various joints, and this is similar to horses with paralytic myoglobinuria. So that's it. That's the study. So there's a couple of issues I have with this type of study. We call these diseases these really very silly names: bovine stress syndrome and fatigued pig syndrome and fatigued cattle syndrome. I mean, just call it what it is. They're not being treated well, you know. And when you have a bunch of factors, maybe it's the drug, maybe it's season, maybe it's weight, maybe it's the stress or whatever, then just say you don't know, and just say that we're going to use this term temporarily to describe this collection of symptoms and scenarios that affect these cattle, but this is not the final answer because we don't have enough information. We need more research to figure this out. When these names get used in the literature, they get spread, and it makes it seem like the disease itself is a mystery. And yeah, it may be, but it's only a mystery because we haven't done the research for it. It's not because it's some unknown disease. And there's enough explanation here to say, like, these cattle and pigs are under immense stress, probably because of how we treat them. So, I mean, it's fine to have reports like this to give a warning to folks, and there might be some foul play here with using a drug that really shouldn't be used anymore. But to me, it seems like, A, we're not treating these animals well, and that's a huge part of what's going on here. B, there may be different diseases. The genetic one is going to be different than one that's caused by lifestyle, environmental stressors. And then C, stop calling these names unless you're going to specify these names are temporary until we actually have answers for this condition. So, it is what it is. You have to accept what you got here, but multiple issues with this write up. All right, we'll see you guys in the next video. Take care.